Are you there, Farhad?
Yeah, yeah.
Okay, so I am going to start recording the presentation. So, Farhad, thank you for joining me. And just to let everybody know, we are both members of the Zoroastrian Medical Association worldwide. That's been created by Zal Kantinwala. He's been very keen that we do some educational and informative sessions for the general population. So to introduce ourselves, I'm Dr. Azmy Birdi, and I do a lot of work in women's health and some in population health. So that includes the HPV vaccination and cervical screening and dealing with women's health problems. Farhad is working, Dr. Farhad Cooper is a specialist in sexual health, and he works in a sexual health and HIV clinic in London. So we're both going to talk about the HPV vaccine. Farhad, did you want to say something?
No, that's great.
Okay, shall I share the slides then? Yeah, and we'll start off.
Hmm.
Okay, and here we go. And can you see my presentation, Farhad? Yeah.
Yeah, I can.
So we've got up. So it's really, I labeled it protecting our children from HPV. So Fahad, would you like to tell us what the HPV vaccination HPV is? What does HPV stand for?
So HPV stands for human papillomavirus. And Admi, you would you like to read through the slides because you prepared them, and I can always step in at any point.
Yeah.
It'll
So
be a joint.
yeah.
Yeah.
Yeah, so it affects the cervix, and I spoke about cervical screening earlier, and nowadays cervical screening involves testing for, as you say, HPV, which is the human papillomavirus, and the reason we look at the cervix is that it's very easy to sample. It's sitting there. It's The HPV, the human papillomavirus, infects the basal cells, the deepest layer of the cells at the junction of the ectocervix, which is the outer cervix, and the bit that is going inside the cervix, which is called the endocervix. And what happens is it disrupts the membrane. It breaks. There has to be some break in the membrane for the virus to enter. And once it enters, it acts like a bit of a hacker that it disrupts the signaling mechanism, the effective functioning of the cells, the repair mechanism of the cells. It's because the cervix sits in the vagina, when there's period, or when women use sanitary products like tampons inside, when there is sexual intimacy, there is minimal trauma caused there, minor grazes and things, and it heals very quickly. And the trauma is a medical term. It doesn't mean that there's anything the cervix is damaged. But what the virus does is it interferes with that ability, and it interacts then with the nucleus of the cell, and it disturbs the cell regulation, because the nucleus is the powerhouse of the cell. So it acts basically like a hacker, doesn't it? And the thing with HPV, the reason why we're talking about and we're asking about vaccination is that it allows the cells to just grow in an uncontrolled fashion. And if it's unchecked, it can progress to cancer. But before that, it goes through a long period of precancerous change called CIN, which is cervical intraepithelial neoplasia, because it's gone inside the cell. It's intraepithelial, inside the lining, that deep basal lining, and it's affecting the cell regulation. And it's the risk of getting a human papillomavirus infection is higher if you're immunocompromised, if you're a smoker, or you have an aggressive type. So Farhad, what types do you see in the sexual health clinic?
So there are two parts to my job. So I do sexual health, and then I also do HIV clinics for people
Mm-hmm.
living with HIV. And throughout, in both groups, we see lots and lots of people with genital warts. And that is something that we can really, really reduce or completely prevent if only people were vaccinated before they become exposed. And genital warts are harmless. They do not lead to cancer, but they're incredibly annoying and people don't like having them. And that's one really, really no-brainer reason to get the vaccine, I think. In people who are unfortunate enough to have, say, an immunocompromised state, which is very, very rare. So most people living with HIV have really good immune systems because they're on effective treatment. But yes, it can lead to problems. And we know that actually some people, whether or not they're immunocompromised, will have cancers that are related to HPV. And that is something I see in the other bit of my job, which is in HIV and oncology, where we know that nearly 5% of all cancers on this planet are linked to HPV. Again, completely preventable, almost completely preventable.
Preventable, yeah. Yeah. Because that brings us to the natural history of the virus. That is, most infections can actually resolve, can't they? And they do within 1 or 2 years. And it's only if you have a persistent high risk type of HPV or you're in a high risk group that it can progress. And when I say high risk HPV, we mean certain subtypes. There are 100 different types of HPV, and they are certain ones like 16 and 18 particularly that are the ones that are associated with changes in the cells that can eventually develop into cancer. As you said, the ones that are associated with warts, like 6 and 11, those are the different types of HPV, and they don't lead to cancer. They can lead to other symptoms, but not the genital warts. And some others just don't cause a problem. So when we say it's high risk, it means that subtype of the virus is high risk, not that the patient is high risk. But certain behaviors may put a patient at increased risk, mightn't it?
So behaviors, but also actually we've found that HPV is everywhere. So, we say it's ubiquitous. If you look at people's bathrooms, if you look at their towels, if you even sampled my fingertip and you did a DNA swab, you will find HPV everywhere on all of us, whether we're young, old, sexually active or not. And we know that it's a skin infection. And so, of course, certain behaviors like having sex may actually transmit HIV. Sorry, may transmit HPV. I'm very used to doing HIV in my work. Sorry.
No, it's okay.
We know that that's a part of it, but I think the key message is that HPV is everywhere, and it's very, very hard not to come into contact with it unless you're vaccinated.
Mm.
Um,
Yes, yes, but it's still the thing is, Fahad, if you put it into Google or any of the AI things, or just a Google search, it says it's the most common STI, sexually transmitted infection. That's what it says.
that's actually
Is that
not
misleading?
that's not true. So if we look at under 25s in the UK, the commonest STI will be chlamydia. If you are only wrongly thinking that HPV is transmitted by sex, it takes you down the wrong road, because
Exactly, yeah.
know that plenty of people who have never ever had sex, who have never had oral sex even, who have never been in contact with anyone else in an intimate way, will still test positive for HPV. And we know from studies we've done in the developed world and the developing world that that is also linked to hygiene. It's linked to washing oneself. It can be linked to towels. It can be related to having HPV on our fingers, and we know it lives around us. So we call it fomite spread when you have a virus.
Yeah, touching things and yeah.
So I think that's incredibly misleading and also unhelpful, because it may put people off from protecting their children. from this virus that leads to cancer.
Right, right. Yeah. So the thing is, although most infections actually resolve, if you have a persistent infection, particularly with one of the high risk subgroups, it can progress and it can reactivate years later. Am I right that people can something up? Because one of the things that creates problems in my practice,
Mm.
when we invite women for cervical screening, they get an diagnosis of high risk HPV, and they may not have had one 5 years ago. Now, one of the things is that it's only recently that the screening program has adapted. So we are actually screening first for the virus. And if the virus is not present, they don't go on to actually look at the cells because the risk of cervical, picking up abnormalities is low. But some women have had and say, why was I negative 3 years down the line, 3 years before, and why am I positive now? It leads to tension because they suspect their partner, or
Mm.
the partner might feel that I haven't done anything, it's down to you. And it does cause tension in relationships. So, and we encounter this, and it's exactly like you say, it's so much in the environment, and sometimes it just goes away for some time and it can reactivate. So um the best thing really to do would be for the people who are coming through now, our youngsters coming through now. That's why I said, how can we protect our children? Is if they are vaccinated in youth, then it's the best thing for them. And again, just to say that it takes a long time for cancer to develop. It's not as if it's going to develop overnight.
And I think it's also never too late to vaccinate. So we know that maybe 50% of us, if we have certain HPV subtypes in our body, we will clear them naturally. However, we know that if we also then vaccinate ourselves, even after we've come into contact with them, that will help us clear those. So it's never too late if you've missed a vaccine at an earlier age to then have it later.
But isn't there a cutoff then, Farhad? Isn't there a cutoff? Because I think you can go up to 25 or 26. And then I think for men who may have partners who are also men, it can go up to 45. Am I right? Or correct me if I'm not.
So there are two issues. One is funding, and depending on the body that's providing it for free, and one will be what the safety profile and the tests on the vaccine were done by the company that makes it. So I think the non-covalent vaccine, which we use currently, if I'm not mistaken, we're told that it's safe in people between the ages of 8 and 45, I believe. And I think NHS England has a special program which has been in place for the last 10 years at least, saying that if you are a male who has ever had sex with a male, then you are eligible to have the vaccine until the age of 45. But in my clinic, for instance, we do make exceptions. So if there are people who have high risk HPV in other sites, so for example, if you've had anal smear tests done, and you're found to have them, then we also do vaccinate. And I think it
I
just comes
see.
to funding. It's not a case of it's not being safe for them to have it.
Yeah. So it's not a safety issue, but it is a policy issue, isn't it? They have a cutoff, so it's just to, um, for people to understand what the recommendations are, because then they're unlikely to get it outside that range, unless in the context of a specialized clinic.
Specialized clinic, or also people are going and buying it because it's not the most expensive thing in the world to prevent so many cancers
Yes.
that you could do for yourself. And I think, you know, one shot costs about £150, and so many patients who have maybe outside of the age group or the specification from the NHS are choosing to do that.
Yes. So in fact, that brings me to the HPV vaccines, which are, they're made up of virus-like particles, VLPs, and it's the safety comes from the fact that they have no genetic material. So people can rest assured that they cannot cause infection in themselves. And in 2006, there were there were either the bivalent vaccine, which protected against the two main types of high-risk viruses, 16 and 18, was launched. Then in 2009, we had the 4-valent vaccine. And then 2014, there was the 9-valent vaccine, which was available, but the NHS brought it in, I think, a bit slightly later than that. And currently, it's the 9-valent vaccine, which protects against 7 cancer types and the 2 wart types. And the 7 cancer types cover 90% of the HPV-related, cancers worldwide. And as you said, that, now, of course, we are vaccinating girls and boys, but at that, in 2016, they were not, it wasn't regardless of gender. So it was started off with with girls and those who had a cervix. So I paid to have my own child vaccinated, and that was available. So in terms of effectiveness, they are very effective, the vaccines, aren't they, in terms of protection? So they say that the women who've had them 15 to 26 years, at least 96% protection. But they've all been trialed, I think, in the clinical trials. These are all people before they had their sexual debut. And they find that vaccinating children actually mounts a much better immune response.
Mm. Oh, and it's not just about cancer. Like I mentioned, they're just incredibly annoying if you ever get warts. And, warts is something we're all aware of from when we're kids and we go swimming and you get a verruca or you have warts on your hands. And when I started in my job in about 2007, the first time I did sexual health, every single clinic I'd be treating people's warts. And now it's just so rare. Because virtually
and it's painful, isn't it? Sorry to interrupt you, but that wart treatment is irritating and it's painful and it's uncomfortable.
It depends. So if you are having cryotherapy or a form of freezing therapy, it's uncomfortable. Creams are not painful, but they are annoying. Again, you have to apply them a couple of times a week, or another cream morning and night for a couple of days every week for weeks on end. And it's also it also puts you off wanting to have intimate relations. It means you might transmit to somebody else. You have to put your life on hold, as it were, for a while. So yeah, it's great that the vaccines have really cut down the amount of work for me treating them and hopefully patients suffering with them.
And what about condoms? Because, that's the thing, because you were saying that puts off people having relations. Would condoms prevent against that?
Only if you have only the bit that the condom covers. So warts are a skin condition, and without going into too much science, warts generally affect bits of skin that are more fragile. So yes, you can get them on any bit of your body, but it tends to be the genitals. And so yes, the condom's only going to cover the shaft of the penis, but if you have warts in the pubic area, on your scrotum, anywhere else,
they will transmit one day. They will be passed on, yeah.
skin needs to touch skin to get transmission, really.
Yeah, I remember very early in my career when I was just a junior doctor, and there was this lady having a C-section because she had a lot of genital warts.
Mm.
And I remember having to catheterize her before the operation. And my goodness me, there was so many warts. I mean, the anatomy was just because she had several warts there.
Yeah.
And I think the worry was that her child would, be infected because they do cause problems in the larynx, don't they? The warts and then the throat as well.
I mean, thankfully, situations like that are very, very rare nowadays. But yeah.
Yeah, yeah, because of the universal vaccination. So nowadays, what we are seeing is when you see HPV in clinic, they're picked up during cervical screening, Farhad, And the thing is now whereas previously you had to take, I remember the old days when I had to take a smear and then you had to put it on a slide and then they would say, oh, the cells are not so good or they have an infection or whatever. They may have had a lot of discharge or they were bleeding. Whereas now it's a very quick test, isn't it? And then only if there's high risk HPV positive, then would they go on to look at the cells. And then if you did have that and the cells were abnormal, the next step would be to be referred for colposcopy, which is like a cat, Do you do anything or is that offered in your clinic?
No, and in England, and I think in the whole country actually, sexual health clinics are discouraged from doing it purely because sexual health, we're very proud that we don't expect patients to give us anything more than a mobile number. You can expect complete confidentiality from us in terms of what name you give and what address you give. And we just worry that if we were to find someone with something potentially malignant or pre-malignant, that there may be problems linking them into care or even contacting them. And so we encourage everybody to have their smears done with their GP.
Yeah.
There are just a handful of exceptions. If people don't have GPs, then we might do them.
Yeah. So the thing is that, people should be, because a lot of people feel, especially the young people now who are coming through the system, and they're getting their first screening invitation because they're turning 25 and they're saying, but I've been vaccinated, so why should I have the cervical screening? So what would you say to that?
It's a great question. And I think my clinicals are audited whether what we see has changed in light of how many years of vaccines we've had. And the truth is we don't have the data to be sure. And I think that's what you have to tell people and say it's still very early days for us to be that confident that a screen is not going to potentially pick something up for you. That's why we encourage it.
Yes. So they may be, in any program, vaccination program, they're non-responders, or people who do not mount an adequate immune. So it might have been strong initially, but for some reason, the immune system in some people doesn't stay as sustained as it should be. It's not as sustained as it should be. Sometimes it's because we all know that during periods of immune compromise, things break down and systems break down. So for whatever reason. And then, as you say, there are 7 types there are different types that cause problems. And if people have had the the um, the bivalent vaccine and the quadrivalent vaccine, then they may not be protected against the others, and something else may come to light. So what I tell them is that you still have to, because screening plus vaccination will give you the strongest protection, because we're picking up the virus early and we have the opportunity to treat and to eradicate it before it can cause any changes. They think it's a screening test for cancer. It's not. It's your screen. Yeah. You're screening for changes before you get to that stage. So it's a bit like putting your seatbelt on before you start the car, because then it's good. That is the protection, isn't it?
I think
So now
people are receiving the vaccine at different ages, and of course we cannot know everyone's personal life, and we also don't test to see. We don't have a test to see whether they may have already been exposed to certain subtypes of HPV before they receive the vaccine, which will also potentially alter the protection they get. So it's just a blanket piece of
yeah.
advice: should still get screened.
So if for both girls and boys, we want them to be vaccinated, and now it's a universal vaccination program, and it starts at 12 to 13, and it's just one shot. Is that correct? Of the HPV vaccine now, the non-valent vaccine. Um,
Yeah, I believe so. In my practice, it's different, but you'll know more about children. In adult practice,
yes.
we actually for people we depending on age basically. So after a certain age, it's a course of 2 vaccines, And if you're living with HIV, it's 3.
Yes, so exactly. So that's what the advantage with vaccinating them young is, because they mount a better response when they're younger, and when they're 12, 13, that's year 8 or year 9 in school, they get 1. If they're over the age of 15, 16, then you give them 2 shots of it, a booster dose, because immunity wanes, we know, with age. That's why babies are vaccinated, because that's the time that they can mount a good response. And then I think if you're immune compromised, or which a lot of HIV positive people are, then they would have to have 3 shots of the vaccine. So, and the good thing is now that because girls started getting it as early as 2006, 2007, the although universal vaccination regardless of gender was not carried out at that time, we are seeing decreasing numbers of infection even in males who did not receive the vaccine, and that's because it builds up something called herd immunity. So that if there are fewer people with it, then it cannot be passed on so much. There's less fomites, as you say, less virus circulating in the community. Though, of course, you do have people who may have come from other places where there is not a vaccine, or there has not been. But it gives stronger protection for the whole community. So it has a knock-on effect. So in our area, East Berkshire, there are significant numbers that, in years 8 to 10, that are not vaccinated. And funnily enough, it's it's the boys rather than the girls who may not have the vaccination. Families still decline. And to look at why they said they wouldn't, I mean, there's a strongly held belief my child isn't sexually active yet. So it's exactly the seatbelt thing that, you don't expect them to be at this stage, but you do it before, they get to that stage. Um, Sometimes they're cultural and religious barriers. So I have even, I have friends and in India, particularly where my family come from, and they say that, will it make my child more promiscuous? Will it make? But there isn't any evidence, is it, from lots and lots of data we've had from all over the world, that actually young people, it's bringing the age of sexual debut, their first sexual intercourse forward in any way. There's no evidence to show that. And then there's vaccine misinformation. And sometimes it's, these forms are sent out and they're meant to be filled electronically, and they're sent via email sometimes. And if people struggle with English as a first language, then some of the consent may seem a bit ambiguous, and they don't know what to do.
Mm. Oh, I agree 100%. I mean, to me, it's a no-brainer, because this isn't just something to do with sex. It's to do with 5% of cancers on this planet. And these are cancers that don't just affect your genitals. We're talking about head cancers, neck cancers. We're also talking, so it's cervical cancer, as you know. We're talking about anal cancers. So these have a huge impact on people, no matter what your gender, no matter what sexual
Correct.
exposure
Correct.
you've had in your life. That's almost completely preventable with a jab. And it's just it's a no-brainer to want to protect your child from 5% of all the cancers out there that don't discriminate.
Yes. Yes. And the thing is, we are lucky that the cervical cancer vaccine and the cervical screening program is it's the only approved screening program, isn't it, worldwide, really? You don't have that for anal cancer. You don't have it anywhere in the world. Nowadays, I think what they're reporting, particularly in countries which have had a very active a vaccination program, HPV vaccine, offering it out, like countries like Australia and then now in the UK, is that actually cervical cancer, the commonest HPV attributable cancer, is no longer cervical cancer, it's oropharyngeal cancer, and that is becoming the most common one. So and the only way to prevent it really, reliably is vaccination. So I think that we should make it easier for parents to be
Mm.
able to give consent um, for their children, because a lot of them think that it's for cervix only, and
Yeah.
that's why I think the boys, they're less bothered, about the boys thinking that, this is a bit of overkill.
I mean, there is an important point to make here, in my opinion, which is that it's a very gendered problem. And unfortunately, we live in a world where most of our decision makers are men. And when you look at sites of the body where we find HPV, the vast majority of cancers found will be cervical cancer. And of course, cervical cancer affects people with a cervix, which is mostly
Yeah.
women.
Yeah.
And we look at the burden of disease in the developing world, and cervical cancer rates are through the roof, and they are so easily preventable, but yet the funding hasn't gone. Similarly, we look at how women are stigmatized about their sex lives and told, oh, well, this is something that you need if you're sexually active or promiscuous. And therefore, there's this idea that no, my child shouldn't get the vaccine because they're not in that category. But of course, this is something that is primarily going to affect our girls and women. And it's grossly unfair when we have a vaccine that is cheap and so effective. And of course, not vaccinating the boys is a disservice to our girls, because a lot of the girls will catch it from boys if and when they become sexually active, if the boys have it. But equally, girls and boys are going to catch HPV from
Yeah.
their environments. So it's
Yeah.
an incredibly gendered problem, and we must not add more prejudice to that disadvantage that
Correct.
we already have for our
Correct.
girls by
Yeah.
not letting them have the vaccine.
And I think it's very good that it is universal, they're offering it universally, because they are, nowadays, people may not identify with the gender, or they have a different gender compared to the one they were assigned at birth. And anyone with a cervix, should have it. But some of them, if they are actually identifying very strongly with a particular gender, if it was for women, may not even think of taking it up. So it's nice that it's girls and boys. And to that effect, I just like to say that, if you're a trans woman or a trans man, it doesn't matter. Anybody with a cervix still inside, a person with a cervix, should still have the screening. So yeah, the medical community still refers to it as girls and boys, and that's how it's rolled out. But anyone with this, I mean, at that level, regardless of gender, you'll be vaccinated. But coming to the screening program, anyone with a cervix, it's a person with a cervix, however they identify with. So, in terms of coming back to the what's happening now, I think it's taken on by schools. Schools send electronic consent links, and the parents have to respond by email or text form. And then I think they have a follow up for no response. And then I think that so it's not construed as harassment, or you're not, sort of, the parent needs to feel not pressurized. Once they decline, they cannot be contacted until a year later, so you can't keep on bombarding them. That's the so it we do need to do what we call GIRF now, in get it, GIRFT, get it right first time. So if you can do that, then it's nicer.
Mhm.
So, at the end, just saying that, is it safe? Yes, millions have been vaccinated worldwide. I think the commonest and a very rare side effect is some allergic reactions. Do I need it before marriage, before even before they're not sexually active? Yes, I mean, it protects future health. Some people may never be sexually active, but you still should have it. And why should boys? Because it causes other cancers. And it's about, exactly like you said, Farhad, it's about cancer prevention. It's not about sexual activity.
Hmm. And also, just to add to why boys, it's to protect our girls as well. Boys will transmit to other people, and we know that our girls are already disadvantaged when it comes to cancers. There's a reason why the cervix is most commonly the site of HPV-related cancers, and it's because of the type of cells that the cervix has.
Yeah.
They're very delicate. Our penises have keratinized skin on them, which makes them more robust. Now, yes, boys do get penile cancer, but let's just imagine for 1 minute that this was a problem that primarily led to men having cancer of the penis. I think every parent in the world would rush to get their son vaccinated as early as possible. And this is something that we have to address. And boys are part of the issue, and boys being vaccinated is part of the solution.
Mm-hmm. Okay, so but what's our final message is, it's that, HPV vaccine, I would say, actually saves lives, and when I say save lives, is not necessarily cancer related mortality, but the morbidity, and prevents you, it saves you it can give you a better life, even if it does not increase your longevity necessarily in itself. And the other thing I'd say is that actually at the moment there's no cure for HPV, is there? There's no definite cure. Even when it's eradicated, even when you treat it, can recur. And I have seen that. And people get very distressed, particularly those who have been, they've led really good moral lives. They haven't done anything that it could be remotely termed as risky behavior in their minds, so they've said, I've done all the things, particularly people from certain backgrounds. They feel they're being judged as being immoral or promiscuous and things like that. And for them, it causes severe distress because they in their own minds, in their own selves, they feel very, very stigmatized and very ashamed. So it's unfortunately something that you can't eradicate, but you can prevent. And it's important that we do protect our next generations from this. Is there anything you wanted to add, Farhad? I'll stop sharing now. Um, um, yeah.
No, I think you've explained it beautifully. And also, you mentioned about side effects in the probably tens of thousands of doses I've prescribed and helped sort of facilitate in my clinic. I don't think I've ever come across anyone have an allergic reaction. It's just something I've never heard of. It's probably the best tolerated.
I haven't come across anything like that either. I mean, and I don't think it's particularly painful either. So thank you, Farhad, for your time this Sunday evening. And again, to tell everybody that Farhad and I are doing this on as members of the Zoroastrian Medical Organization or Association worldwide, and we're trying to do our bit for public health across the board. So we will upload this to YouTube in due course. It's being recorded, obviously, so I am now going to stop the recording, and uh, um, we will stop.